everyone, it's Lori Brown from empowerednurses.org and yournurseattorney.com. And I'm so thrilled to be talking to Jasmine Christine here today. She is a nurse in Phoenix, Arizona, and she is going to share her experiences on the front line. And her heart led her in a direction of starting a Facebook group to support nurses who are also on the front line and other healthcare professionals as well. So I'm thrilled to have you here. And so first of all, Jasmine, let me just say thank you. Thank you from the bottom of my heart for all that you do for, I mean, who knew nurses would be, I always say when the World Health Organization said that 2020 would be the year of the nurse, we had no idea that the nurses would be the epicenter of this pandemic. So I just want to thank you. Thank you for helping. Thank you for being there. Thank you for all the patients that you take care of.
Oh, thank you so much. And I have to share that with all of my colleagues in all the health professions because we're all in this together right now. So I'm very fortunate to be able to be here and speaking with you today.
Well, I'm thrilled that you're here as well. And now you're in Phoenix, Arizona, right? And where are you working?
I work at Mayo Clinic.
Okay. What area?
My specialty is neuro, ENT, and plastics. So helping with strokes, brain tumors, spines, and then complex head and neck cancers.
Oh, wow.
Mhm.
And so what are you seeing now? Because everything's kind of on hold.
Right. It's a very interesting time period. I think, as you're aware, a lot of hospitals have they've stopped elective procedures. So really, what we're seeing are people who've been admitted back into the emergency room for another medical reason. It's the quietest we've seen the hospital, I think, that I can even remember. So, like, we do have open beds, but um, it's just, I think it's kind of eerie in a way. We walk in and everyone's, it's different, it's a little more tense. Usually I remember when I first started working at Mayo Clinic, I thought I'm working at the Disneyland of hospitals, right? It's like everyone's so happy and upbeat, and now there's definitely a change, and it's a lot more serious with people that you're walking around. We're focused on, gosh, how many times am I touching my face during my shift? What am I thinking about? And you're so focused on those small routines that maybe we need to change, that we're missing those hellos and those moments of actually reaching out towards our colleagues.
Mm. So what good have you seen from this? Have you seen any good?
I think what I'm really excited about at Mayo Clinic is that they were really thoughtful from the moment, I think, of building the hospital. We have not just negative pressure rooms, but there's an actual like floor that's negative pressure. So they were very thoughtful in the build. And I think our leadership has been very proactive with continuously sending out messages and keeping us in good communication with what's happening from a hospital level. I think what's happening from a national level is just the concern of, what exactly do we need? So, the CDC giving recommendations based on lack of supplies is causing confusion, because what exactly are we doing in what situation? So the guidance, I think, from farther up is actually one of the greatest barriers that I see.
Mm. And I think we were talking beforehand about not just changing guidelines for COVID patients, but also C. diff and other patients as well to conserve supplies.
Exactly. Right. So we need to be good stewards of our own health and our work environment, and we don't know what's going to come. So we look at other states that they're forecasting not having equipment in 1 to 2 weeks, and I don't think any hospital wants to put themselves in a position where they just don't have equipment for one reason or another.
Right, right. And we were talking about homemade masks and that they don't work.
Oh, I think that's so frightening. I 100% am so appreciative of anyone who is sitting at home and thinking, how can I help the frontline staff? What can I be doing? Because what I'm seeing and what I'm so happy about is just this whole wave of people who are helpers. They want to help and they want to have an active role, but making masks, I mean, it's better than nothing, but the research that I've been reading so far clearly shows that it's actually worse. It harbors bacteria,
Right.
and that's not what we want.
Yeah. Yeah. Well, hopefully they're going to figure this out. I think there's creative ways to solve this problem. One person was saying maybe even like vacuum cleaner bags because they don't let the dust out, and obviously dust can't get in it then. But if the question is on the reverse side, if you're breathing your own germs, rebreathing them.
Right. And I think that's the other great thing about what's happening is people are being so innovative. We're thinking about how can we be doing things differently? And there was a physician who he actually created a YouTube video. I'll send you the information. I can't remember his name off the top of my head, but he's taking masks from CPAPs and then putting in a filter on the front. And so that way you have the mask on and it has a filter, and it's actually an N100 filter.
Wow.
So and it's plastic, so you can clean it easily. I mean, I don't know what that would look like if you can just dump it in bleach to clean it off at the end of your shift, but it's really forcing us to think outside of the box. And they say that chaos is the mother of innovation, and I think we're seeing that live in real time.
Yeah, yeah. And I think that we've come together as a world to help,
Mhm.
because we're seeing so much good coming from this that people are actually, wanting to help each other. And I know, like you said, so many people are sewing masks and want to help nurses.
Exactly. We just have to find the right way to have them help us the best.
Right.
Mhm.
And I think at this point, toilet paper.
Exactly. And if you did hoard some masks, we wouldn't mind if you brought them back into the hospital. That would be very much appreciated, because we need it in order to best take care of people. Like, we can't, it's like the airline when you hop on a plane, they always say put the mask on yourself first, because you can't help the person next to you if you're not breathing.
Yeah. And that's so important for nurses during this time to please help yourself first. Take care of yourself. Don't put yourself in danger, because then you're not good for anybody. I remember when I started as a nurse, I always joke back in the days when the dinosaurs roamed the earth. And um, I was saying uh, that with AIDS was brand new then. We didn't understand much about it. And we had to take precautions with these AIDS patients. But then when you have somebody who's like vomiting and they pull out their NG tube, and you don't want to, you don't want them to aspirate, your first gut instinct is to run in the room and put the NG back in regardless of gloves. And you can't do that. You got to take care of yourself first.
Right. And then those are those things that I think we're taking those extra moments of really being cautious about the small things that maybe we weren't as aware of as before.
Yeah. So how are you holding up through all of this?
Being in Arizona, we haven't really seen the load that's coming through from other states.
Mhm.
But I have colleagues that I speak to frequently who are in the like Ohio area and New Jersey and Seattle and Oregon. And um, I think just even listening to what they're going through, not only is it making me feel anxious, like, is this what's coming here next? But it makes me want to hop on a plane and go and help and figure out, sometimes I think as nurses, we feel like if we're not there, then we're doing a disservice. And we want so badly to just step in and help where we can. And that feeling of helplessness, it's definitely pretty pervasive. And then fear, a lot of us with our families, we don't want to be around them. We're keeping our distance. I don't go anywhere other than the store and walking around outside and work, and that's it. I talk to my family every day, but I haven't seen them in 2 weeks because I don't want to get them sick. And they're older, and the last thing I ever want on my mind is, was there something I could have ever done to prevent them from becoming ill? So I've just been talking to friends, and I actually started crying on my way to work on Sunday, just randomly out of the middle of nowhere, just because it's the thought of helplessness, both as do we have everything that we need to care for people to the best of our abilities? And that includes beds, space. Do we have everything? I don't know. And that's just generally speaking. And then each other, I think about it at work and I'm like, which one of my colleagues is going to end up with COVID? I'm sure a lot of us probably been exposed to it. We've maybe even had it, and we are lucky enough that we don't have any symptoms, or we can resolve it quickly. But there are people that aren't going to be able to handle it so well. We're just like our population.
Yeah, exactly. What they are doing is having the states have lowered their requirements to become a registered nurse.
Mhm.
So if you're in your last year of nursing school, check, you may be able to go to work and help. If you've had an inactive license for less than 5 years, you can go back to work. So there's lots of things that the states are doing to lower the barrier to get some more help and get some more nurses in there.
Yeah, but see, that I'm actually a PhD student at ASU, and I'm a TA and I teach there, and I think about the students that I'm teaching right now, like, oh my gosh, my heart is like breaking for them because they're still learning. And I've been reflecting on what do you feel like when you're a new graduate nurse, and how you're still navigating and figuring things out for like the first 6 months or so. And gosh, like, we're going to send out these baby nurses who they haven't even really had that period. They're just going like straight out and helping, hopefully, with maybe small things, whether it's admitting or shuffling people around, whatever it is. We're going to need the help, I'm sure.
Right.
But
There's
just
things that they can,
concerned.
but it is scary because if you're being like thrown into the fire without having any type of uh, you know orientation to this, it's difficult.
Yeah, and I think a lot of our practices are habitual. They develop over time. Like,
Mhm.
you're still learning them in school, but they're really developing them in the first few months. And those small things like running in a room with gloves, like, maybe they haven't got that down 100% yet, the importance of that.
Yeah, and what it's just scary because it takes a while to get your nursing sea legs to be
Exactly.
able to work, and to be baptized by fire is
Mhm.
um, it's a very difficult situation. And I just hope this situation doesn't dissuade people from wanting to become a nurse because they see what nurses are going through and how difficult it is. And we have a shortage as it is, and that's
Right.
concerning as well.
Well, if anything, I hope it inspires more people. I hope what people are seeing around the country is that nurses are standing up for what we believe in. We are moving forward and being at the front lines and helping people navigate this uncharted territory. And I hope, if anything, it really helps inspire people that, gosh, like, I want to be a nurse one day.
And I think this, for the first time, nurses are really speaking up and saying, this is what we need. And
Mhm.
I think that's also a good thing.
Exactly.
Yeah. So, what have you done to help other nurses during this time?
So, after my shift this weekend, I just kind of came home and I was like, we need to do something to help support us and cross the barriers. I think things are happening at such a rapid pace, and we're all spread out around the country. And if we could have one place that removes all barriers from institutions, from levels of profession and what we're doing, and really kind of come together and have a place where we can talk about, hey, what are you doing in your institution that is like a workaround? Because nurses are innovators, and we are constantly doing things to try to make it better. And I would love to know more from nurses in New Jersey. What are you doing differently, and how can we make that happen in real time where I'm at? And really making just like that connection, and finding a place where we can support each other, because as we know, our families are tired of probably hearing anything from us, our family and friends. And you know we've all posted online like, stay at home, and I think we're all going to probably say that till we're blue in the face. But having a place where we can decompress away from them is really important. So I created a Facebook group. It's called COVID Support for All Healthcare Professionals. And it's a place where I'm hoping to be a little bit of a beacon of light and hope and support for anyone who really needs it. So I brought on some colleagues. I have a friend, Chloe, out of Ohio. She's a PhD student nurse there. She's doing yoga for the group. I have Dara James, who is a postdoc at ASU, and her specialty is in mindfulness. And so she's going to be leading mindfulness activities for people. We also have Nicole Vianu, who is a nurse health coach.
Mhm.
She's fantastic. So, really helping to work on keeping centered and keeping a hold on our healthy habits so we can take the best care of ourselves. I'm trying to bring in a comedian to help keep light. So really just in a real-time place where not only is there support and people being able to offer skills and services that are helpful for us and
Mhm.
support. We also have a nightly prayer too. My friend Lauren, I forgot to say that, but just like spirituality, it doesn't matter what religion you are, but just like this is a time I think where we need a healthy dose of spirituality to kind of get us through, and coming together in a non-denominational way will be fantastic. So that in combination with the sharing of ideas and spreading innovations, that's what I'm looking forward to, seeing the good that comes out of this.
And that's what the beauty of nursing is that it's a holistic approach, and you're looking at it from body, mind, spirit, and it's wonderful. It's
Thank
really,
you.
yeah. And I just applaud you for taking the leap and saying, I'm going to do this, I'm creating this, and being a leader.
Well, thank you. I just am excited to create this space for the magic to happen.
Yeah, awesome.
Mhm.
And it really is an amazing group. So please check it out. And you talk about nurse innovators. We've seen in the news about how the nurses are now keeping the IV poles, the pumps out in the halls with extension tubing, so they don't have to gown and glove every time they go in there.
Exactly.
And about the ventilators that can be used for more than one patient if they're the same size. I mean, so a lot of innovation, like you said, is coming out of
Mhm.
this.
Exactly. I think that's what's really cool to see.
Yeah. So are your parents worried about you?
Yeah, they are. I
I
know
think that's
that.
the hardest part, the
I
family.
know they are for
Yeah,
sure.
yeah. Um, well, I just want to thank you for all that you're doing and for being the leader that you are. And please, everybody, check out the Facebook group for support, because there's some really great stuff happening in there. Um, you can't do this alone. We're all in this together. And if we band together and take care of our body, mind, and spirit, we're going to be so much further ahead. Um, so I encourage you to check it out. And
Yeah.
thank you, Jasmine, for being part of this, and for speaking to everybody. I think you can help so many people.
Oh, thank you. And please, it's for like the group is for everyone. It's not just nurses. It's our physicians, our therapists, housekeepers, whoever is right there with us. We're all in this together.
Yeah,
Mhm.
thank you. All right, bye
Thanks for
everyone.
having me. Bye.